Alright, today we're going to talk about the breast self-exam. It is important for women between ages of 20 and 30 to have an annual exam. Some say from 1 to 3 years. A lot of it depends on the physician and the personal history for each individual. After age 40, it is recommended that you have an annual clinical exam and to have an annual mammogram. You need a baseline mammogram done between ages of 30 and 35, or 35 and 39. You need an annual. You need a baseline so they have something to compare it to. It is really important to do a monthly breast exam. Usually you would do your exam 5 to 7 days after your period, but for postmenopausal women, they would pick a day of the month that's familiar to them, like their birthday or just a familiar day, so they did it the same time every month. The clinical breast exam and the self-exam is actually pretty similar, except for the self-exam. She would be standing in front of a mirror, and I want to explain it now. You would start out and standing in front of a mirror with just your arms down to your side, and you would observe for any discoloration, any dimpling, anything unusual. You would inspect the breast, the areola, and the nipple. If they were the same size, it's normal to have for a woman to have a little bit bigger breast on one side, but after puberty, if one breast starts growing and the other one don't, that's probably not good. You would want to look for like a dimpling. A lot of times with breast cancer, you'll get like an orange. It'll actually look like an orange peel. You'll have like a dimpling effect. You would want to look for any lesions or masses on the breast or nipples both. And you would compare the left side to the right side. And you would observe with your hands down at your side. And then you would lift your hands up behind your neck and just kind of observe how they are. And then once again, you'd have your hands at your hips and kind of lean forward and in front of the mirror, because a lot of times with the dimpling, it might not. You would be able to notice it more whenever you lean forward. You would actually start the breast self-exam. You put your left hand back behind your head, and you would palpate down the side all the way down to about equal to where your elbow goes. And it's very important to make sure you check underneath your underarms. You actually have the tail fence, is this area right here, up underneath your arm from your breast, and that's where most of your glandular tissue is, and that's actually where most breast cancers start at, is in this area up here. So you want to make sure you feel it real good. You will use the pads of your fingers instead of just your fingertips, and you would start with just kind of a light pressure, and then a moderate pressure, and then you'd want to go deeper, like up to about an inch and a quarter, and make sure you can feel for any lumps or masses or anything underneath there. You would, like I said, you'd raise your left arm behind your neck, and you would just start up here and go down, and then you would come back up, covering a lot of the same area just so you don't miss any. And you would do that until you reach the sternum, about the midway point, and then you would use your right hand. You move your right arm up above your neck and do the same thing to check your left breast. And you could observe in the mirror. You observe for any dimpling, any retractions, just basically anything that is out of the ordinary. The reason that you start here is you would want to, if you had any kind of discharge, you would want to move it toward the nipple where that you could express it. The clinical exam, and if you did find any lumps or masses or anything, any discharge or anything like that, you would want to contact your physician. And if you'll get the camera, I will show the clinical breast exam. Like I said, it is real similar to the clinical breast exam is real similar to the exam that you would do every month, except for you'd actually have somebody else doing it for you. We would have the patient sitting instead of standing. You'd have them sitting with their hands at their side, and You would just do, you would actually, we know this person here has got something wrong on their left side. So we would want to be able to compare what the healthy breast tissue feels like, opposed to where we already know there's something there. So we would actually start on her right breast, and you would, like I said, you would start at the axillary, and you would use the pads of your fingers, and you would go down, and you would go back up, and she would be in a setting position, and you would do a sweeping motion, and then you would do the same thing on the opposite side, and like I said, you would overlap. As you went up, you'd overlap your movements. You would have her extend her arms back behind her neck, and you would just do a sweep over her chest, and you would have her lean forward so you could observe for any dimpling or retractions or anything like that. And then you would have her lay down, and you would palpate the breast and do basically the same thing over again. You would actually go over the nipple, and you would depress it into the well back behind the areola. But you would not pinch the nipple or anything like that. Like I said, if there's any discharge, your movement would push it toward the center. If you did, like in this example, if you did find a lump or a mass or something present, you would actually document this in a clock-like position. You would initially write down that this is the patient's left breast. You would want to chart that. You would look in the clock position. Her mass is in the 1 o'clock position. You would measure the distance between where the mass is and where her nipple is, where you could document that she has a mass or a lesion at the 1 o'clock position in her left breast. You would want to feel of the lesion. My fingers is a little bit over a centimeter. You'd want to feel of it and see if you could estimate the size and kind of how thick it is, the width and diameter, and kind of get the dimensions of how big the lump is inside of it. If you could feel around, you would want to be able to tell if it's got a regular shape or it's irregular, if it's round. You would want to know if the borders are discrete or poorly defined. If there's any dimpling or depressions there, you would want to make a note of it. If there's any retraction, any altercation in the contour of the breast, you'd want to note. The lump itself, you would want to make a note whether it was firm, smooth, soft, hard, just kind of what it feels like, so that if it does grow or anything happens, you would be able to compare it to somebody else could look at your records and they could compare your findings to any further findings.